Good evening, everyone. Welcome to the webinar. I'm Dr. Brooks, and I'm just kind of getting my computer all set up and ready. What I did do is I put in a handout for you all. So just go ahead and click that handout, the PDF that's in your chat box, for a little bit of notes for tonight. That way you can take notes while we're going along. So hopefully that will help. So let me get myself open here as some of you are joining in. Give me just a second. Okay, so I'm going to go ahead and get started. I am pretty timely. I'm sure like most of you, you're off work, you're ready to go home. So I don't want to spend any more time than I promised that we would spend. So anyway, again, I'm Dr. Amber Brooks, and tonight I want to talk to you about the 4 categories of autism, treatment and healing. Apparently there is an autism conference going on here. I think it's sponsored by Generation Rescue. I also know Generation Rescue will be here in October. And I don't know why. I'm just finding out about this now. So I apologize to those of you that get our newsletter. We did not know. But we'll look up that information for October, and we'll get it in our October newsletter. So you can go to generationrescue.com and find out. It'll be downtown in Dallas. And this weekend also is at, I believe, the Intercontinental Hotel. And there's a bunch of speakers. A lot of the MAPS doctors are speaking, which is great. And then, of course, Jenny McCarthy will be there. So anyway, that's always fun. For those of you that haven't met her, she's a hoot. So let's dig in. You all know there is no, I'm not giving any intention on medical care or treatment. This is really for educational purposes. So for those of you that have an integrative medicine doctor or biomedical doctor, always consult with them. They're the ones treating your children. If you need help finding a doctor, you can let me know. Obviously, you can come here to our practice, or we can try to help you find someone. Right. All of this information is my own. If you want to use it or reproduce it for any reason, you need to get my written consent to do so. So here's about me for those of you that I haven't met at some point. I have a practice here in Dallas, like I said, and it's whole child wellness, and we do pediatrics only. I have an integrative approach here in the practice, so I like to combine the alternative and the traditional because I really believe strongly that that's how we get our kids better. I have been working with children with autism for a little over 8 years. Most of the kids in our practice are on the spectrum. And a lot of them, if not all of them, also have MTHFR, for those of you that are familiar with what that is. I am board certified in pediatrics as a chiropractor. I'm also a craniosacral therapist and a registered nurse. So I've got an eclectic background to bring to the table, but it does give me kind of the ways to use things that I need to do to maximize the work that I do with kids. I also wrote a book that you might find handy. I wrote it really for my parents. To let them know if I could tell them, what would I tell any parent that was either coming into the practice, needed help? How would they recognize in their children that developmental delays were starting, that other people ignored? You know, how do I keep parents from coming in at 4 because they didn't know to come in sooner, right? So it's a really great book that kind of walks you through the gut stuff and the infant stuff and the developmental delay stuff. So I always say it's really good for any parent, whether you have a child with autism or delays. It's also a great book to give a mom who's pregnant because it talks about how to set up the gut when they're infants and what goes wrong there and how we end up messing it up, although we don't know we're messing it up. I also founded a nutrient line called Healthy Kids Nutrients. My practice website has lots of information on it to utilize. It's mychildwellness.com. Lots of studies, lots of research, lots of information. My web designer is actually getting ready to upload a ton of our YouTube videos onto the pages that are applicable onto the site, just making them a little more accessible for you. So we do have the YouTube account at Whole Child Wellness, and we have about 20 videos up because we see, because I see so many children with autism and special needs, a lot of the videos are catered to many of you that are on this call tonight. And then, of course, my personal website is dramberbrooks.com, which has our courses and webinars previously that we've recorded that you can click on and attend, or ones that we have coming up in the future. So if you're on Facebook, you can find us there. I announce a lot of these things on our Facebook, so you can like us there and kind of catch up with us. So these are the 4 types of diagnoses that we're going to go through tonight. And this has been something that was kind of the mainstay of what we learned as doctors, probably going back 10 or 15 years ago. And of course, this was when all of us were convinced that this wasn't a psychological condition, which we know we've had to battle with from a legal standpoint and from a insurance standpoint, but that there was definitely some underlying issues with all of these children. And what were they, and how did we know what kind of testing to do, et cetera. So I have done some webinars on autism and GI function, MTHFR, a bunch of other things that are autism related. But tonight I really wanted to talk about where certain children may fall. And this becomes really important in some ways. Obviously, if you're with your physician, they are gearing the types of things that you say and the types of things you report and what you put on your paperwork to really gear what types of testing they do, where they dig, et cetera. So I wanted to give you as the parents the information that we as doctors have, so that you can look at some of the signs and symptoms that you have in your own children and assess whether those things have been looked at by your doctor, because a lot of these things, to no fault of your own, are things that you don't really report. Odd behaviors. Like I have a lot of children that come in and they don't do certain behaviors that they would do if they weren't here. For instance, pressing on their private parts, pulling, the little boys pulling on their penises, things like that I always ask about. But that's because I've seen so many kiddos with autism and related gastrointestinal issues. But that wouldn't be something that we would ever ask on paperwork, So I kind of want to go through the types of symptoms that you may see, so that you can report or let your doctor know, or if you're not under care, let the person that you're going to choose in the future, if you're looking into doing that, so that you can have the best care. The more information you give us as parents, the better off we can, or the better of a job we can do for you and your child, and the quicker they will heal from the things that we're finding that are broken. So we're first going to dive into the immunological part. And so these tend to be kids that have frequent infections. Now, of course, the older kids that come in to me, older, what does that mean? My 9, 10, and up kids may be perfectly healthy now. And you might not have even remembered when you go to do the paperwork that they had, ear tubes when they were 18 months old, and they had ear infections every month for 9 months, and they were on antibiotics for a year straight. So when I know this gets hard, especially the older they get to really remember, but I really want you to try very hard to go back to this, because I think all of you at some point, hopefully, have been able to get some education around what every kid with autism will always exhibit in the gastrointestinal issue. So 70% of your immune system is in your gut. So if we have a kid with frequent infections, not only do we want to address the GI, but we also want to address the immune system. And I was just explaining this to one of my moms today when we were going through labs with her, that if you treat one and ignore the other, you can't possibly heal it. So both of those things have to be addressed. There's also a lot of things that come up in testing that your doctor will find anyway, but it's always nice to know that a 9-year-old had a horrible history of chronic infections as a child. Chronic inflammation, this is not something that you're going to be able to necessarily see. This is something that we will see in testing, but things that you may see. They complain about stomach aches, or they're doing posturing, which means, they might be leaning over furniture. They might be pressing on their stomach. They might have horrible skin rashes, and you've tried every cream, changed their diet, done allergy testing, and nothing seems to make it go away. Those are signs that the belly has got an immense amount of inflammation in it, and you need that stuff needs to be addressed. Also, those parents that have histories, either mom or dad have a history of irritable bowel, Crohn's disease, really bad allergies or even celiac. Those are things that we unfortunately pass down to our children, particularly those children with autism. So chronic inflammation is kind of one of those things that's a given that a child with autism will 9 out of 10 times have, if not 10 out of 10 times. The real question becomes, how bad is it? And how long is it going to take us to heal and work on it? And I always tell parents that, you'll be the first one. If I recommend testing, you'll be the very first one that comes back with. If testing is indicated by your doctor, they're not doing it to waste your time or ask you to spend money. It's really because we're expecting to see something. Now, that's something we don't know because we can't tell the future. However, that's kind of how I explain it to parents. I know it's not going to be perfect, but I need to know how imperfect it is to give you a reasonable expectation of how long it's going to take to fix it. Autoimmune reactions. So these could be things that you know about yourself as a parent, or things that you seem to have. Let me give you an example. I just taught a CE for clinicians last night, and we talked a lot about we talked about the top 3 complications in children, and one of them was looking at the skin and examining the skin and what kinds of things that can tell you. And I had an 11-month-old that we talked about last night, and I showed the pictures of this child's skin, and everything she ate, she reacted to. Now, is that possible that your body could react to every single thing that you put in a mouth? No. What that tells us is something is severely broken in the immune system somewhere, and that is what needs the attention, right? But parents and maybe I would say maybe your pediatricians and things like that will focus on the things like food, especially if they have rashes. This specific child had rashes on her face and around her mouth, so naturally it had to be a food allergy. But being 11 months old, there's really no food testing we can do. So the good news is we worked through it, but those things are the things you'd want to look for. Environmental allergies. So obviously mold exposure is a big one. Food, which you may or may not know, and then chemicals in the environment. So these can come and really tax their immune system a lot more than a child that doesn't have autism. Symptoms. So symptoms of this immunological portion, like we talked about, eczema, allergic shiner. So for those of you that don't know what that is, it's the dark underneath the eyes, and we call them allergic shiners because a lot of times it's due to some kind of food allergy. And they're the kids that, when they're real dark, you might have even seen this kid walking around at a grocery store. I mean, I can spot a kid with allergic shiners, as you can imagine, from a football field away sometimes. They look a little sickly. So your child might look a little sickly. Or some people think, well, they've always had them. It must be genetic because I have them. So it's always nice to be able to get, and of course, yes, that could be true, especially Hispanics and things tend to have darker circles. But with the African-American children, I can't really tell. But with them, like I have one right now, he has immense puffiness under his eyes. Like it looks like he hasn't slept in weeks. I always say it looks like Oprah, bless her heart, she's got those big bags. It kind of looks like that. So paying attention to their eyes is really important. Asthma, of course, or chronic, that allergic rhinitis, which means their nose is just running. Your mouth breathers, warts, things that you can't get rid of. Most of us know that warts are viral, but that's also telling you that the immune system isn't happy and is not working well. Molluscum contagiosum, which maybe some of you may have had an experience with, but this is caused by a virus of the pox virus family. You can get the infection in a number of different ways. Obviously, with children, it occurs when they come into contact with a lesion. And usually they have lesions on the face, neck, armpits, arms, hands, but really they can be anywhere. It's spread through contact with contaminated objects. So this goes through daycares like crazy, as you can imagine, just like I'm sure if your kid had hand, foot, mouth. Typically, the lesion begins as a small, kind of painless little bump, and then it might become really raised and have kind of a pearly, fleshy colored nodule. And that's molluscum contagiosum. So scratching obviously just spreads it. So that's not helpful. There's usually no inflammation, no redness. So that's usually not an issue. But at the core of it, sometimes there's like a white, cheesy or waxy material. And that's really something that, because it's viral, a lot of times they just kind of let it ride. So it's something to be aware of, that if your kid has a history of that, that would be a really great thing for you to tell your doctor, right? Because it tells us that, wow, the immune system was really, really challenged. Cold sores, same thing. This happens quite a lot. And cold sores in kids can be quite easy to fix. I had one that was having them continuously, and as long as we kept him on high doses of zinc for a period of time, he did fantastic. Zinc is a huge contributor to the immune system, and we gave him quite a bit of zinc, even above and beyond what's in our multi, and that's what he needed. But he didn't show a zinc deficiency. That's kind of the funny part about it. At least not, in testing. So sometimes we have to look at the symptoms. So it's, again, very helpful for you to be reporting these things. If they had thrush as a baby, which is, that white tongue, nail infections, if they've ever had rigid nails, if you're suffering with poor growth. Now, most of us, if not all of us, including myself, will do a growth chart. We'll keep track of height and weight and let you know where we're at. But if you went through a time, which I have one right now, who hasn't gained weight in 2 years and is now coming to me because their pediatrician doesn't seem to be worried about it, and that's obviously something to be worried about. Poor growth is a deal, right? That tells us that they're not getting the nutrients that they need from food, and we need to figure out what's going wrong in that system. PANDAS or PANS, very popular topic to talk about. I'm not going to get into it, but it's pediatric autoimmune disorder caused by strep. So this is a strep. Yes, it's the same type of strep that you get in the throat. The only difference is typically if you think your kid has strep throat, which if you have a child with autism, their pain tolerance is so ridiculously high, you're not going to know most likely. But if you happen to know, if they happen to swab it and it happens to come back positive, I always want you guys to make sure that you treat it appropriately with antibiotics. And I say that because what happens when you don't get rid of strep is it turns and goes into the brain and becomes PANDAS, which is something which is a very rigorous treatment to treat. So always make sure you're getting rid of your strep. I know, but strep, just so you know, can live in the nares and the nose, and it can live around the anus. So if you ever have seen a red ring around your child's anus, that could have been strep. So things to watch out for. These are always questions I ask. I actually test every kid for strep when they come in. Obviously, again, because most of the kids in my practice have autism and are nonverbal coming in. So, I don't know if their throat's ever hurt. I don't know. We don't know. We've had kids, and I know the same story, bust a eardrum, break an arm, and didn't even cry. So that's something you'll want to report to the doctor, or say, I never know if he's sick or not, so that they can run proper panels in blood to make sure that everything is okay. And then, of course, abnormal detoxification. Now, what does that look like? That looks like the kid that has reactions to things. So if you ever had a vaccine reaction or a reaction to medication, I have a child right now who took amoxicillin and her hair started falling out. Of course, do you think amoxicillin causes that? No, there's obviously something else going on. So she is losing her hair. And so that's pretty scary. So that's a sign that something is not going right. Gastrointestinal. So this is going to go, I'm going to say I have yet to see a child with autism that doesn't have gastrointestinal issues. So your child might fit into one of these categories, two of these categories, all four of these categories. There's not a right or wrong here. This is really just to give you some more information. And I always say to hold us as doctors responsible for the things that we're doing. Because sometimes, I have people coming in to see us and we ask for your think but certain testing I definitely always want to see. So always share with them, I have this, and this. Would there be anything is there anything you want me to make sure I bring copies over that I scan in PDF to you before the appointment? So always check with the doctor, because it's really our preference on what we want to see. Some of it, food sensitivity and allergy testing, I always want to see. That is always going to be applicable no matter how long ago it was. You'll have with gastrointestinal issues a lot of overgrowth. So you'll have inflammation or redness on their cheeks, on their face, a red anus, which we already talked about, anal itching. Maybe they're always in their pants. You might see peeling feet, rigid nails, rashes. they also will have nutritional deficiency. So when we test them, never normal, right? And that's because everything is so inflamed in that belly and in that gut, and in turn their immune system, that they're not pulling the nutrients from food that they need to. They're not digesting their food correctly. So nutritional deficiencies are a given, always a given. It's really important for you all that are on the phone tonight. If you don't have a doctor, you need to get help. I can't urge that enough. I had a mom just come in with her child. The parents brought him in. Excuse me, I'm drinking coffee. He is 4, and she was on the mom groups with y'all, and she was doing supplements on her own, and she actually didn't do a bad job. And I told her, you didn't do a bad job. Now, some of this I would never give, but I was telling her, if you got some help, you actually could have saved yourself some money, because a lot of these things we can put into, a multi that we use. And any of us doing integrative medicine or biomedical work, we always use pharmaceutical grade supplementation. I mean, I'm hoping everyone is using that, which means those ingredients are active, right? They're not synthetic. They weren't made in a lab and then put into something that your body can't recognize. And that's the biggest thing with any child, not just a child with autism. We do not want to be giving them synthetic vitamins. That is the most important thing that I can stress to you. Pretty much, unless it's pharmaceutical grade, it usually is synthetic. So if you have any questions about that, bring the vitamins to your appointment, or, our patients, I said, just send me links to it online and I'll check it out. The supplements that they come in on, because they are no good, really. They're kind of just trash. So when I say get help, I mean really get help, because you're going to spend a lot less money in the long run if you know exactly what's going wrong and exactly what supplements you need to take. So you don't waste a lot of time. I think all of us can agree, a child that is diagnosed with autism, the longer you wait to try to get help to heal them, the harder it's going to get for you to do so. So please, please, please get some help. Symptoms of the gastrointestinal stuff. So of course, animal stools, this could be constipation, so they don't go. And what does that mean for me? They must poop every day, or I consider them constipated. If you're having to help them with Miralax, that doesn't count as normal, right? If a kid is taking Miralax to have a daily bowel movement, that's not a normal bowel movement, right? Because our bodies don't have a deficiency in Miralax, correct? I think we all can agree on that. Although Miralax is great to use short term, there are some really great options for constipation that I would rather use. They're a little more gentle. I'll always tell parents, if they're really not sure how often they poop, I would say after the age of 5, it gets a little harder, because they become more independent. They're going potty on their own. They're able to wipe themselves. I'll have them keep like a poop log. So if you're not sure, this is what I think you should do. And it works. You just print a calendar from your computer and put stickers in the bathroom, or a stamp or whatever, and tell them every time you poop, I want you to put a sticker or a stamp on the day that it is. And then that's a way to kind of keep track of how often they're pooping. Another thing we typically find is when I send parents home with testing to do poop and to do their urine and stool at home, they'll often say, oh my gosh, it's been like 3 days and they haven't pooped. And so that's the first time you've ever realized, oh, I just assumed they went poop every day. And we can't assume anything. If you really don't know, you really don't know. The last and final thing I do, I would say I go through bouts, and I think it's just depending on, the new patients that are coming in, but I'll send them for an x-ray. If no one really knows how often and they don't know how often, then I'll send them for an x-ray to make sure that they're not impacted. And about 90% of the time they are full of poop. And then we'll do a clean out over about a week or 2, and then we'll do another x-ray, and we want to make sure that's cleared out, which can drastically turn around their behavior and their comfort and their happiness. Diarrhea is also another one. That's something we need to know. A lot of kids with chronic diarrhea actually have parasites. So it's definitely something that it's a little hard to catch a parasite on testing, to be honest. So depending on the symptoms and things, your doctor might choose to just treat you for parasites anyway, as kind of a, let's make sure those are gone. And encopresis is basically stool that leaks out. And so that's something that, you'll know, because it's like, it just kind of comes out whenever. Failure to thrive can be pretty serious. I guess the medical definition of this is a child that is kind of wasting away, if you will, right? They're in the, 5th to 15th percentile for weight and 75th percentile for height. And we want those percentages to be very close together. We're okay if your kid is at the 70th for height and weight, but when they're at 75th for weight or height, excuse me, and 15% for weight, I get very worried that they're not getting what they need to thrive, right? To grow, for their brain, for everything. So this is something that most parents will see it as, they haven't gained weight in a while, or they kind of look very sickly, or they don't eat much, or they snack all day and they don't have a proper meal. And I always say kids are smart. They're very smart. If they don't want to eat something and they're picky eating, they're doing it because they're in pain. If they don't want to eat a full meal and they snack all day, it's because they can only, hold so much in their stomach before their stomach starts to hurt. So they'll do whatever they have to do to meet the requirements that they need to meet. Just because they are not speaking or they're nonverbal does not mean that these symptoms are not there. It's just things that you need to be educated on to look for, which is what tonight's all about. And then wasted buttocks. This is kind of, where you kind of see, I guess the picture that I have in my mind is the kid with like no butt and a big distended belly. So it's basically where muscle's being eaten because the body is kind of starving, if you will. And then a distended belly, that's where they've got that big poofy belly all the time. Some parents can really tell because they'll wake up with a flat stomach, and then by the end of the day, it's huge. And there are so many reasons for that, which your doctor can do testing to determine what that is. But it's very helpful for them to know if that's something that you've noticed. And then, of course, constant drooling. And I would say kind of mouthing as well. If they're at that age, obviously past infancy, where they're still mouthing things, putting things in their mouth, licking objects they shouldn't, metal, dirt, the floor, the walls. I've heard it all. Those will be things that you'll want to tell them. Because again, with some people that are seeing your kids, they're not going to think always. It just depends on what triggers in my own mind. I'll admit, am I asking that question? Am I asking, do they put anything that they shouldn't in their mouth, or do they lick odd, or do they, some kids will have this thing with smelling. They have to smell everything, and that's probably more sensory than anything, but something to also report to them. So metabolic, this has grown so much over the last, I'd say decade or so. And this is really, when we talk about GSH, I should have typed that out. Sometimes I'm not, I'm wearing my doctor hat too much when I'm writing these, but GSH is glutathione. And glutathione depletion is a big deal. This primarily is an amino acid that is for detoxification. And it is in the pathway of the methionine cycle, which is directly related, or I would say touching, your folate cycles, where a child with MTHFR or other genetic SNPs, this will be the reason why a lot of times. So if a child with autism, we already know they all have gut issues. We also know that their bodies have an innate inability to detoxify perfectly, right? Now, what does that do to? This could be metabolic. So it's something to research. Every kid that comes into my practice gets tested for MTHFR because I need to know if it's there, because it does change the course of my treatment. And of course, I want to make sure every parent's educated. If they have it, they need to know what to do, what not to do. But as a result of that, a lot of their bodies are under lots of stress because the detoxification pathways are not working well. So most of us out there are kind of know about this. There's not as many doctors that know about MTHFR or the treatment or how to work with it. Of course, there's nothing I can fix genetically. I mean, I think we can all agree. But if you can do testing on the pathways, which we can, then you can fill in the gaps of where things aren't so perfect and support their bodies, just as you would with a multivitamin or anything else that was going on, so that those genetic mutations stay quiet, which is what we want them to do, because we can't change their genetics. And this works very well for kids that have MTHFR, as long as, I always say, part of being in practice and working with kids with autism is, part of it's an art and part of it's a science, because the science part of it is what supports the groundwork or lays out the plan in some ways, but the art of it is having the experience to know what works and what doesn't. And MTHFR is very much something that is art and science. Science we can't always follow. Sometimes we have to go on how the child reacts. So again, I've done YouTube videos on MTHFR. I've done webinars on MTHFR. So if it's something you're interested in, you can also see our website for a really good explanation of what it is. For those of you that know, it's not a big deal. But for those of you that don't, I really suggest highly that you look into this if your child or the child that you're listening in for has autism. There has been research presented in the last couple years that children that are born with MTHFR have a 2.75 times more likelihood of having autism. Now, does MTHFR cause autism? No. Just like vaccinations don't cause autism. And I think my personal experience tells me that it takes many things to cause the autism to kind of come to the forefront. But having an MTHFR mutation doesn't help, right? Having vaccinations when they're babies because they don't detoxify well doesn't help. And then you add up all of these things in the environment that they're exposed to, and, bad food and bad environments and bad chemicals and all that fun stuff. And then it's just kind of enough of the straw that breaks the camel's back, and then boom, you're diagnosed. But there is a correlation with MTHFR, and that's because primarily, and I want to stress this, with anyone with MTHFR, you have problems in one way or another, or can have problems in those detoxification pathways. The same goes for every child with autism. Their detoxification pathways are also challenged. That's just the way that it is. So those two things tend to be very similar to one another, but one obviously doesn't cause the other. It just puts them at higher likelihood. Just like if you guys have done a lot of reading on autism, having a family history of autoimmune disease, hypothyroid, Hashimoto's, autoimmune, different things like that also puts you. So you having irritable bowel and Hashimoto's doesn't make them autistic any more than having MTHFR does. I have MTHFR and I don't have autism. So it's just one of those things. I would say more children, because 40% of us have it, more of us are running around with one of the SNPs than without it. But it's definitely something, if you have a child with autism who also has MTHFR, life definitely needs to be a little bit different for you. And there's ways that we can educate you and help you through that, as well as watching you long-term to make sure that to make sure your child stays well long-term, and that they just don't get well for a couple years and then you're back in your doctor's office because everything went to shambles. So symptoms of the metabolic stuff, they may react to supplements. So you might have the child who anything you've ever tried to give them, they go super hyperactive, or they don't sleep for a night, or they break out in a rash. This also happens with medications and with vaccines. Now, it doesn't mean they react to all of these. It could just be one. You can't seem to get all the symptoms under control despite all your effort. So I have a lot of people that say, I have an 8-year-old with autism. We've done everything and we still have issues with XYZ. So this is usually the missing link for those of you that have gone down the road already. And it's really because the missing link from the metabolic standpoint is there's so much more that we know in the last decade that we just didn't know as much about when your child was little or maybe first diagnosed. So I always tell parents, don't be afraid to make a second go at it, especially with everything that we know now. Behavior, they may be a little spacey. They may be a little hyperactive. I kind of explain this kid that's spacey, the lights are on, but nobody's home. Their eyes are open and you think that they hear you, but they're just spacing out. Eating is a struggle. They can be very picky eaters despite therapy that you've done, whether that was feeding therapy or occupational therapy or sensory work. So these are things that you also want to look for. Mitochondrial issues. So the mitochondrial are really responsible they're kind of the energy house, if you will, of the cell. So we're talking about very little itty bitty, cells in the body. And with mitochondrial issues, those show up in our urine test. And it can tell us a lot about how the body is having a hard time. This does go back to, in some ways, detoxification, but kids with mitochondrial issues will have regressions in development, periods of time where they've done great and then they've had a regression. They'll usually, when we test them, have low glutathione. They'll have nutritional deficiencies, of course. They may have methylation problems. And this basically, without having to go into a lot of this, is basically the easiest way to explain it to you is detoxification trouble. And again, like I said, every child with autism has detoxification trouble. It just kind of depends on how messy it is. These are really things that you wouldn't know. These aren't going to be things that you can really come to the doctor and say, I think they have mitochondrial issues because, this is really some stuff that we find on testing. But letting us know that there's been a regression in development is always super helpful. So some of these symptoms, if you have any of these, acne, canker sores, muscle twitching, kids that crave salt. Another one too is trouble with mood balance. That's a big one. Pica, many of you know what this is, but this is when kids put weird things into their mouth that they shouldn't. They want to chew on coins. They want to lick the walls. They want to eat pencils, and objects that are not for consumption. Let's put it that way. And this can be just deficiencies is what pica comes down to. So, but eating those things and licking those things, those are always things you want to tell the doctor, that they, some want to chew on things all the time. So again, just something to report so we know what to run in our, might have low muscle tone, constipation, and speech regression. Now, when I say regression too, it's something really important to note that some parents have reported to me, when they're sick, they have a regression. If they get, an illness, they regress. When they had a vaccine, they regress for a little while. If they're overly fatigued, or they stay out in the heat, they might regress for a day and just be wiped out. So these are stuff, because again, at a mitochondrial level, this is what's supplying energy to the body to watch. This I kind of want to go through because those are the 4 that I wanted to talk about as far as kind of the basic 4 types. This I kind of want to go into, how are kids treated in the traditional model, and then how are kids treated in the alternative model. Of course, in the traditional model, you take them into to their traditional doctor, whether that's a pediatrician or developmental pediatrician or a GI doc. They observe them, they diagnose, they treat them based on the psychological components first. They're taking into account the behavior, their specific symptom that you're reporting, right? Many of them are not doing labs. And if they are, they're not really doing them to the degree that they should. And what I mean by that is they might do a stool test and not a urine test, or a urine test and not a stool test, or they might do blood panel and do like 5 or 6 things instead of doing everything that they should do. So, and I say should do because if they are claiming to treat or work with children with autism, then these should be things that, yes, they should know, and yes, they should run. The overuse of medications for recurring infections is a pretty big one. You and I both know that. I mean, I can't tell you how many times I've heard, oh yeah, we have an ear infection. And I'll say, okay, well, what ear? Oh, I don't know. They didn't look in their ears. They just gave us an antibiotic. And nothing baffles my mind more than that. Not only, as a doctor, but also having a nursing background. So then of course I'll look in their ears and say, well, your ears look fine. So it's one of those things that you want to ask the specifics. Okay, well, what ear is infected? What does it look like? You have to understand, if a kid is screaming their head off while they're getting their eye or their ear exam, it can make, depending on how hard they're crying, it can make the membrane in there that we're looking at look red. And it's not red because of an infection. It's red because they're crying. So red doesn't always mean an infection either. So I like parents to bring, like in my practice, I say, as soon as you think they're sick or they're not feeling right, bring them in immediately and let me take a look at them. Because, the difference between, the onset of an ear infection and needing antibiotics is usually something you can avoid. And they've even published this in the pediatric journal. Of course, none of them seem to listen to it, but that's okay. So just know that a lot of times, especially with ear infections, you really, really, really need to make sure that you're treating an ear infection. Psychotropic drugs are usually offered as the first line of defense. So if you come in saying my kid has ADD, they'll go through a plethora of medications that they can give you. Alternative medicine, they observe, diagnose, treat the physiological components first. So what does that mean? That means they're getting a full clinical picture of your child, right? They're doing an exam, they're doing lab work, they're doing proper lab testing, and they're looking at the specific issues that your child is suffering with. Unfortunately, with children with autism, although many of them have or follow the same patterns, none of them look the same as individuals, right? So it's really important that if you're going to go down the road of that, I'd say integrative care or biomedical care, that they are really being treated as an individual and they're really looking at the whole kid, because that is so important, right? If I treated every kid that came in with a quote unquote autism diagnosis, I probably wouldn't have that much luck, right? Because they all have different needs, which is why I think just throwing supplements at a child with autism, you're lucky if any of those will work. So that's why I would rather you guys, I love it as a community that parents come together and support each other. But what I don't want is parents supplementing based on their kids' symptoms. Like my friend has a kid with autism and they're taking these supplements and they're doing great. That's probably the biggest waste of your money. Hopefully those supplements were given to that child by a doctor who knows them, who's tested them. So I always tell my parents, as part of my paperwork, you're not allowed to share this, to share their treatment information, to give out to anybody, because I don't want a parent kind of hijacking something that they think will work. I really want to make sure the parent gets to someone for individual care. So that is how. Now, is middle ground? Absolutely, there's a middle ground to doing it. It's just with children with autism, we can't throw medication at them as a first line of defense without first ruling out any physiological components that we can take care of to try to avoid those things. And I think every parent wants that. So here's common treatments when we combine the two. Like I said, I think it's important. Proper testing, that's more of your traditional method, right? Traditional blood testing, for example, and I do urine and stool testing that's maybe kind of in the middle somewhere. Addressing nutritional and immune deficiencies, really important, changing their diet. I think this should be something that you work with your provider on. I also don't think there's anything wrong with parents just doing gluten and casein-free diet. I think it's one of the ones that we can back up with enough research that I would say, in my experience over 8 years, that maybe 70% of parents see an actual change, whether that's in stooling, sleep, behavior, bowel movements, whatever. There's the 30% that don't see a change. Does that mean it's not working? No. It just means that, that's just not a huge trigger for them. But I always am a fan of a gluten-free, casein-free diet, because there are two things that I have proven to myself over and over and over and over again through testing over the years that are highly inflammatory. I hardly ever test a kid for their food sensitivities without seeing one, if not both of those, and we have to keep them out long term. So that's why I always think it's a really great diet to make sure to try, and then also to make sure that you're doing correctly. So when parents come in and say, oh yeah, we're already on a gluten casein-free diet, they still get the gluten and casein-free talk from me, because I just want to make sure that we're on the same page, because not everybody has consistent information online, right? The Google doesn't know everything. Adding in necessary nutritional supplements. This is obviously more alternative than traditional. And this is going to be based on symptoms that you tell them about, and obviously testing. Prescription medications as needed. There's quite a lot of prescription medications that I think should be used. And when they should be used, I communicate that with their pediatrician and also with the parent, and tell them why I think this is a good action to do in the short term. So it's definitely something that with some things is really your only answer. And of course, these things are not used for long term. Craniosacral therapy, amazing. I don't know if any of you have looked into this. It made me think when I mentioned the Generation Rescue I spoke at a conference a couple years ago on craniosacral therapy and autism. It's something that I've been doing for 10 years, but didn't really make the correlation on how it helped children with autism. So I do explain craniosacral therapy in a YouTube video and also show a demonstration of it. So if you want to learn more about it, it's a great video to watch, and it's on our YouTube channel. Chiropractic care, of course, is something that I offer in my practice to all the kids. I think it's so great to make sure they stay healthy, that everything is in alignment, their nervous systems are working at their best. It can only be of benefit to a child on an alternative standpoint. Proper evaluation for school placement and therapy, I think, is so imperative. Of course, that's not inside my wheelhouse. That's evaluation for your school. But if they're seeing a therapist and there's accommodations that they think need to be made, then I would urge you to have them write letters to the school. I'm also, a huge letter writer on behalf of my parents, whether they need a gluten and but they're just crazy parents, from taking supplements at school to allow them to, this sounds really crazy, but I had to write a note for a little girl so that she could keep her bottle of water with her on her desk so she could drink water throughout the day. I mean, talk about stupid, but those are just kind of the stupid rules that some schools have. And so never be afraid to ask your therapist for accommodations or letters the way that they can. And then therapy, I'm a huge therapy, just huge. I have to constantly be telling parents to go for referrals. I will challenge a lot of times if the kids aren't doing better and their existing, I would say their existing places that they're going. And sometimes that can be, the therapists have gotten very comfortable with the children, don't really challenge them much. And all of a sudden they're feeling better because they're under care and they can be challenged more and they can be pushed more and they're really not doing it. The other thing and the other issue that I have to bring up, because unfortunately I have to sometimes be so truthful it hurts, is if they're getting their therapy at school, you have to know a couple things. Most of the time, these therapists have so many children on their books that they're seeing multiple children for that 30 minutes. And if your child wants to sit in the corner and stem or have a tantrum, they can't just be spending time with your child to calm them down. They have 40 other kids to see that day. And so I hate to say it, but if your child isn't quote unquote cooperating, then they don't really get anything from that therapy. Now, I understand that it's part of the school system. I understand that it's free, but it's meaningless a lot of times. So a lot of times when kids are under biomedical care, they will do exceptionally better in their therapies because you can imagine would absolutely be more apt to learn and be more, I guess, have the ability to focus longer and get more out of therapy. So sometimes I'll ask them into another therapy place. Maybe it's time for a change or what have you. This is specific. I want you guys to be very specific and careful about who you pick as occupational therapists. There are so many places out there, as you probably know, with occupational therapy and speech therapy. Occupational therapy, children with autism almost always have some sort of sensory issue. Sometimes it's severe, sometimes it's really not. But occupational therapists are not all taught how to work with sensory children with autism. This is something that they have to get additional training for, et cetera. So it's really something you want to make sure you ask them and then describe the types of sensory issues your child is having and do they have experience working with them, et cetera. Of course, I have occupational therapists that I refer to that I know that I've worked with for a long time that work with children with special needs and specifically those with sensory. It is not as easy to find when you're looking for the sensory work, but almost always something that's desperately needed for the kids. So the key to health lies in the gut, and assessing a child and treating them when they have autism is really important to be looking at the digestive system. And I think I gave you this slide, but the digestive colonization really begins at birth with breastfeeding. If they don't breastfeed, a lot of moms will give probiotics and things, and that's great. Where they typically will kind of get a little off is when they start introducing foods. And the digestive system really needs to be set up correctly so inflammation is not the first thing that it encounters, right? So I go through how to introduce first foods in my book to all the parents. I really don't want parents doing rice cereal, any kind of grains, or sugar, because that alters the flora in the gut and then creates an abnormal immune response. So those kids are more likely to have food allergies, skin issues, you name it, just be sick. Other causes of flora imbalance. And when I talk about flora, I'm talking about the good bacteria, and there's good yeast in the system that we need to have. Imbalanced essential fatty acids in moms. So if moms weren't taking fish oil when they were pregnant or when they were nursing, then this can cause it as well. So if a baby's not breastfeeding, I usually will giving them fish oil directly into their bottle or just syringing it in their mouth. If they had a history of infections, stress, early vaccinations, multiple rounds of prescriptions, et cetera, will cause the flora to be imbalanced, if not really out of whack. And stool testing reveals for us kind of how out of whack we are, so that we can get back on the right path. In dysbiosis, you might hear this word when you're hearing different physicians talk, especially at conferences and things. So I always like to say what this is, because this is a word that often is used. And this is just a fancy medical term, if you want to even call it that, for the microbial ecology in the body, whether that's bacterial, parasitic, or fungal, that's out of balance. And that usually this dysbiosis is found in the digestive tract or on the skin. And quite frankly, no two kids look the same. As I think I've already said tonight, you could take 10 kids with autism, and no two of them are going to look the same, whether that's looking at their labs or looking at their clinical symptoms, which is really the challenging part that I love about my job. So this is how inflammation in their gut really relates to the brain stuff. So why is it, a lot of parents will say the first thing I noticed, or the first thing that called attention that something might not be right, was the fact that they didn't speak on time. And that's probably the most popular one I hear, because that's the first major milestone people worry about. And I say people meaning the pediatricians. The gut and the brain are connected by the digestive system. So if the digestive system is a hot mess, whether that's, and I kind of made a little flow chart here, whether that's a problem with eating food, being a picky eater, digesting it, absorbing it, assimilating it means it's being used. The nutrients are being used and given to the parts of the body that it needs. And then, of course, excreting it, pooping, right? So if any one of these 5 things is not working, you're going to have issues potentially, not only in the gut, but also in the brain. So the neurological and behavior issues that we see in the children with autism get better when we really look at the gut and really focus there. So that's something to think about. So for those kids that have attention issues, or that were diagnosed with autism and ADD or ADHD and PDD or whatever, that's why a lot of these people that do try medications as a last resort, they don't work, because the gut is just as wacky as the brain, and those drugs don't typically work for those kiddos. So nutrients necessary for growth and development. I just want to touch a little bit supplementation, just a little. I know many of you what to use or want to make a change and not sure. And so I would always say, I would rather you order them through a doctor, or have your doctor order them, or be getting them through a doctor that's doing high quality stuff. OptiPD is the multi-mineral that I use in my practice. I formulated this myself after years, too many years, I should say, of really having to bastardize adult formulations, because I didn't want to use powders, because a lot of the kids had sensitivities to the flavorings, or it had dye in it, or it had soy in it, or it had, stearates in it, or preservatives. So what I ended up doing is I did a vegetarian capsule. Now, you and I both know more than 80% of my kids don't swallow caps. So what we do is we open these caps into orange juice or lemonade, and everything is fine. I've been using caps, and mostly use caps in my practice, because I can avoid the common allergens. I can avoid the preservatives. I can avoid the colors and dyes that are so bad for any child, but specifically those children on the autism spectrum. So it was really something I felt very passionate about, doing it in a vegetarian capsule. so that we could just pop it open and avoid all of the allergens. So I was able to get this very, very clean, which is great. The other thing to note, and that I'll be honest with you about, is my youngest currently in the practice is 3 years old and she swallows capsules. So anything's possible. If there's a will, there's a way. There's some great YouTube videos that go into how to teach your kids how to swallow caps. Obviously, you want to make sure anything you're using is biologically active. We already touched upon that tonight, the difference between synthetic versus bioactive. And there's obviously, I can take one look at it and I can know. So if it says things like vitamin A, vitamin C, vitamin D, what I really want it to be specifically saying is vitamin A as beta carotene or or acetate. Vitamin C is calcium ascorbate. Vitamin D as vitamin D3. That means those things are bioactive. They're not synthetic. So that's one of the easiest ways to tell. If it says folic acid, you want it to say methylfolate. That's one of the most important things you can do. And I kind of put that down. Quatropfolic is our methylfolate. It's actually 6-methylfolate. It's the newest and best biologically active form that we have on the market now. And this is really important for those kids with MTHFR. And since most of your children are going to come up positive for that, you really want to make sure that everything you give them is bioactive. You can order this at healthykidsnutrients.com. Any doctors that are on the call tonight, they can also purchase it wholesale through us to sell in your practices. So anyone can get this any of our stuff online as well. We show the label, so feel free. And if you have any questions, you can email us. So the basics love Speak Nutrients. It's my favorite omega-3 fish oil. This is really designed to support neurological health. They call it Speak for a reason. When they did studies on it, kids started talking. I have more kids that babble, that are nonverbal, that start babbling on this. So you can buy this off our website or from Speak directly. Multi-strain probiotics. We have a variety of probiotics in our line that vary from 50 billion on down to 5. So really important to rotate through. Many of you that are buying probiotics are using the same flora over and over and over again. So it's really not benefiting to do a wide variety by giving the same. Most of what's sold in the stores are the same thing, just a different brand or a different company. They really don't have the financial means, if you will, to get a hold of the raw materials to make a really good quality probiotic that's quote unquote, on the shelf and something that you can buy, very inexpensively. That's not to say that probiotics have to be expensive to be great. It's just, it takes a lot to store these correctly when there's lots of strains in them. Enzymatica, it's the digestive enzyme that we use. It's made by Enzymatica. We use Intolerance Complex. And what's great is they'll also send samples. So a lot of the doctors that use this will have samples. We give samples to all of our patients just to try, especially if they're new at supplements. But you can order that on the website as well. And then our newest is a buffered vitamin C powder. We just added this to our lineup. And we're really excited about this. This gives you a ton of vitamin C, a little over 2,000 milligrams per, I believe, 1/4 of a teaspoon. So it goes a long way, which is fantastic. We would say you, but your doctor should all be doing stool, urine, and blood. And this is actually the front cover of my book. You can get it on our website if you're a paper person like myself, or if you're like my husband who said, if you don't have your book on Kindle, I'm not reading it. Then you can get it on Kindle, iBooks, Amazon, and Barnes & Noble. Also the Healthy Kids Nutrients line, which we talked about, we do free shipping on orders over $150. And a lot of the products on there, I'll tell you, it'll show the label and then tell you what we typically use for it. Recorded webinars, that these are very much similar. I mean, not similar to what we talked about tonight, but in the same wheelhouse as far as if I have a parent on the phone tonight that has a child with autism. These are the other webinars that I think you should think about listening to. You can access them on dramberbrooks.com. On the top menu bar, there's a doctor patient education. Just click that tab. I did a webinar on transforming tomorrow, how behavior and development can improve in autism. and then what the MTHFR, and we talk about MTHFR specifically, how it affects development, cognition, detoxification, and supporting pathways. So I think those will be really helpful for most of you that are on. The next webinar we're doing is in October, and I'm going to do genetic mutations beyond MTHFR. So anytime I have a kiddo that has MTHFR, we usually do a 23andMe. I know a lot of you know what that is. It's a saliva test where we can run the detoxification and methylation pathways and find out the other SNPs. I like to call them the brothers and sisters. So we're going to talk about those other brothers and sisters next month. And this is probably going to be from 6:30 to 8, just an FYI. I haven't written it yet, but these genetic ones tend to be anywhere from an hour to an hour and a half. It is free to attend live. So you can get signed up. If you go to the website, I actually haven't sent out any emails on it because it isn't for another month, but feel free to sign up. And again, it's free for anyone to attend. So any of your friends or family, or if you know yourself, you have MTHFR, this would be very helpful. So pass this along to your moms groups and the moms that you know in the community. This is how you stay in touch with us, through our office email and our websites, of course. So if you ever have any questions, you can get a hold of us, or if you would like to schedule an appointment. If you are out of the state, we're definitely, but go to the MAPS, MAPS website for a doctor, and you can find a doctor. For those of you that have been in the community a long time, they're kind of the new version of a DAN doctor. And as you know, the DAN organization itself kind of said, we're done with this. So the MAPS organization, Dan Rosignol started, is really great. And it's part of what the weekend teaching here in Dallas. So you may find a MAPS doctor closer to you if that's what you choose to do. But sometimes it's hard to find the right fit, and we understand that. So we definitely have, we do Skype and we do phone appointments and all that stuff. So definitely something that we're open to if you have trouble finding someone that you feel comfortable with. If anyone has any questions about anything I've talked about tonight, you can type it into the chat, and I'll stay on the phone for a couple minutes if there's any questions. For those of you that have to go, thank you so much for joining me tonight. I really being here and being part of it. And I hope that it was helpful for you. I don't see any questions, as I'm sure that, I don't know if you guys can see my box or not, but I don't see any questions. So hopefully that means we did a really good job. I don't know. But anyway, I hope to talk to you guys soon, and we will be in touch. Take care. Bye.